We will provide some question and answer opportunity at the end of the presentation. For that question and answer period, please type in your questions and we will respond to them read the questions and then respond to them that way. Today's presenters are myself. I'm Joanne Spetz. I'm a professor at the Phillip R. Institute for Health Policy Studies at the University of California, San Francisco. Also with me are Dolores Jones, the Executive Director of the California Institute for Nursing and Healthcare, although I should note that today officially she is now a member of the board and there is a new Executive Director, so congratulations on that transition for them. And then Terry Hollingsworth, the Vice President of Human Resources Services at the Hospital Association of Southern California. Our goals today are to learn how employers are perceiving the current nursing labor market and talk about how recently graduated nurses are faring. We're then going to link employer and nurse perception data with recent data from other sources on nursing employment and education and assess the progress of transition to practice programs that are helping to provide new graduates with additional skills to improve their employability and their ability to provide high-quality care to patients. We'll then measure supply and demand of nurses in California and talk about next steps for ensuring an adequate nurse supply. This project is a collaboration supported by the Betty Irene Moore Nursing Initiative at the Gordon and Betty Moore Foundation. It's also a collaboration with the California Institute for Nursing and Healthcare, also known as CINC, the Institute for Health Policy Studies at UCSF, and the Hospital Association of Southern California, the Hospital Council of Northern and Central California, and the Hospital Association of San Diego and Imperial Counties, all of which help support the survey work that we're going to talk about today, as well as UCSF staff and interns Dennis Keene, Tim Bates, Leela Chu, and Jessica Lin, who all have been involved in supporting this research. So what is going on with California's nurse labor market? After more than a decade of severe shortage from 1998 through roughly 2008, we've had sporadic and regional reports of nursing surpluses, both in California and across the country. Now this is occurring in the context of a recession that officially ended about a little over a year ago, but we still have high unemployment and a slow economic recovery, and there are severe regional differences. So to talk about how employers are perceiving the current nursing labor market and their employment trends, we conducted a survey of nurse employers. As I said, this was a collaboration between UCSF, CINC, and the Hospital Association of Southern California and supported by the Moore Foundation. It was a web-based survey with the option to return a paper survey via fax or email. Easy for respondents to complete the surveys. The questions for these surveys were based on previous CINC surveys, as well as the National Forum of State Nursing Centers minimum demand data set recommendations. Thus far, we've conducted 4 surveys with the dates you can see below, and I'll be talking primarily today about the fall 2011 and spring 2012 surveys. We asked employers what their perception was of the labor market in their region, with a 5-point scale that ranged from reporting high demand with difficulty filling open positions down through demand being much less than supply available. You can see in 2010 and 2011 there have been some changes, most notably that between the fall 2010 and 2011 surveys, our market moved towards having more nursing CNOs report that there was moderate demand with some difficulty filling open positions. The respondents often made notes that the difficulty of filling positions was primarily in positions that required specialized skills or knowledge and not necessarily for entry-level nursing positions. What they were referring to were positions like emergency departments, operating rooms, and those sorts of areas. They also reported differences across regions. As you can see here, not only are there differences across regions, but those differences have been changing over time. First, in the San Francisco Bay Area, a lower number indicates that there is more of a shortage here. You can see in that region there was really a strong sense of surplus in fall 2010, and now it's moved to somewhat closer of a balanced labor market, where a score of 3 would be a completely balanced labor market. You can see in other regions that may have reported a bit more of a shortage situation previously, like in Sacramento and Northern California, has moved into a somewhat balanced labor market. Overall, the impression across all of California is that on average there are roughly the same number of positions as nurses looking for work, but that there may be an imbalance between specialized positions versus entry-level nurses looking for jobs. There have also been changes in the perceptions of rural versus urban regions. In rural regions, there's actually was a perception that there was a bit of a shortage in fall 2010, but by spring 2012, that situation moved towards a perception of a slight surplus. And conversely, in the non-rural parts of the state, in fall 2010, the markets were reported as having perhaps a bit of a surplus, but have moved towards being more balanced by spring 2012. These are patterns that we have seen previously. When previous nursing shortages have emerged, they typically have emerged first in urban areas and in specialized nursing positions. So these reports that there may prior experience may portend a return of nursing shortage periods. There also are some differences by hospital size, and again, lower numbers in these charts mean more perception of shortage. You'll note that between fall 2010 and spring 2012, larger hospitals moved from reporting that there was a surplus of nurses in their markets towards now on the margin reporting that there is some sense of a shortage. Again, primarily in their writing comments, they indicated more specialized areas. Whereas the smaller hospitals are reporting that in their perception, the supply is greater than the demand. We asked hospitals about changes in difficulty recruiting, and these are data from fall 2011. We asked them about their difficulty recruiting compared to the previous year of fall 2010. And you can see that relatively few CNOs reported that there was more difficulty in hiring staff nurses. In fact, nearly a third reported it was less difficult to hire basic staff nurses in 2011 as compared to 2010. But for other RN positions, 28% reported that it was more difficult to hire for other positions, and that includes the specialized positions as well as things like utilization review nurses, infection control, and case management. You can see also that for LVNs and aides and assistants, the perception is that it was less difficult to recruit in fall 2011 as compared to the previous year. We asked about the change in difficulty recruiting compared to the previous quarter, and these are data from spring 2012, and these are by region. You can see that there has been some change across the regions where some regions have reported that there is somewhat more difficulty, but for some regions there's also been reports of somewhat less difficulty of recruiting. We asked hospitals to report the share of budgeted positions that were currently filled in 2010 versus 2011, and these data are consistent with what you saw previously. Hospitals indicated that a lower share of their budgeted positions were filled for other registered nursing positions than in the previous year, whereas for regular staff RN positions, LVNs, and aides and assistants, the share of budgeted positions filled has been fairly stable at well over 90%. And for staff nurses, really the share filled has been over 98%. We asked about the use of per diem, traveler, and agency nurses. The lighter colored bars are from 2010 and the darker colored bars are from 2011. The orangish color is for registered nurses and the gray is for licensed vocational nurses. You can see that for registered nurses and licensed vocational nurses, the use of per diem nurses has dropped somewhat, and for registered nurses the use of travelers increased a little bit, but those numbers are very low as compared to what we saw in about 2004 to 2008 period. The use of agency nurses also dropped between 2010 and 2011 and are quite low. CNOs were asked about the turnover and the hiring of full-time personnel from fall 2011. And you can see that across the different employment positions, in general, hiring is greater than separations, and these turnover rates are relatively low. The hiring rate for staff nurses was at 11.5% as reported in fall 2011, which is a nice hiring rate. Employers were asked about whether they had hired newly graduated nurses in the previous year, and the vast majority said that they had indeed hired some newly graduated RNs in the previous year. About 8% in 2011 said they don't ever hire newly graduated RNs, and about 9.4% said that they normally hire them but had not in the previous year. Employers were asked about the percent of new hires that were new graduates in spring 2012. And statewide, about 37% of new hires were new graduates that year. And you can see there's a lot of regional variation in the hiring of new graduates, with a greater share of new hires being new graduates in the Los Angeles area and a much lower share being new graduates in the Inland Empire and border regions. Employers were asked about whether they had specific hiring requirements or preferences in fall 2011. 21% indicated that no experience was required for any of their positions or in general for hiring. They might be required for certain positions but not in general. 52% said their current positions required specific types of experience, and over 2/3 indicated that a baccalaureate degree was preferred for their employment. But only about 4.6% said that a baccalaureate degree was required to be hired in their hospital, and only about 52% said there was a required minimum experience level. CNOs were asked to tell us about their new graduate training programs, which are programs for people who have been hired to help prepare them to be fully independent in their hospital. 61.4% said they had a formal training program, which is lower than the report from 2010, but note that different hospitals reported in the fall 2010 and 2011 years, so these differences should not be taken as a sign that formal graduate training programs are on the decline. 87% of those that responded in fall 2011 had developed their program internally, and the remainder were using a standardized program that they had purchased or were in contract with from another organization. The most common capacity of these programs was a class of 20 to 30 new graduates, but some programs could accommodate up to 60 graduates. And the most common length of the new graduate training programs was in the 18 to 24 week range. Hospitals were asked about their registered nurse vacancies at the time of the survey, and this slide compares the fall 2010 vacancy rate with that from fall 2011. You can see there was a drop in staff RN vacancies across those 2 years, and I'll note that the FTE vacancy rate looks a little higher than the full-time and part-time rate because some hospitals responded for the FTE numbers but did not respond separately for full-time, part-time. And conversely, some reported full-time and part-time, but not the FTE numbers. So, but overall, we've got a consistent response rate of less than 3% vacancies in fall 2011. The Hospital Association of Southern California has been conducting turnover and vacancy surveys of human resources directors for many years, and they have data from the second quarter of 2012. Terry Hollingsworth is not able to be on the call at this point, so I'll present these data for her. You can see in the top row the number of responding hospitals in these turnover and vacancy reports from the second quarter of 2012 and the numbers of nurses employed. You can see here that in that quarter there was a very low turnover rate of about 2.1% statewide and a little bit of variation across, across sections. And I believe that Terry has now been able to join the call, so I'm going to hand the presentation over to her to finish discussing this slide. Terry, are you there? Terry? All right, it seems that Terry must be having some technical difficulties in getting herself onto the presentation, so I'll continue the slide. The turnover rate of a quarterly rate of about 2.1% is consistent with the annual turnover rate. Oh, is that Terry?
Yes.
Oh, there you are, Terry. I'll let you continue then.
Okay, I apologize for that. So the HASC turnover and vacancy report is conducted on a quarterly basis. We survey approximately 200 hospitals throughout the state, and we have collected information in the second quarter from 197 facilities statewide. The number of RNs represented include 98,887. And the total of separations reported is 2,097. The turnover rate for second quarter is reported at 2.1%. We collected data representing a total number of hires at 2,364, and the total number of accessions, which is the rate in which employees or nurses are being hired into the organization, reflect 2.1%. Total vacancies reported also for second quarter is 4,504, and the total vacancy rate equals 4.0%. As you can see, the information is reported out by Northern California, Southern California, and San Diego, so we are capturing data from hospitals throughout the entire state. And the report is used as a benchmark tool used by hospitals to compare their own internal rates to those from others in the industry. And so we are planning right now to begin collecting information on third quarter data from member hospitals throughout the state. Joanne?
Great, thank you, Terry. I will note that the vacancy rate reported for the second quarter of 2012 is slightly higher than what was reported in fall 2011, which would be consistent with the sense that the labor market might be turning around a little bit in offering more jobs for nurses. Chief nursing officers were asked about their hiring expectations for the next year, and you can see here a comparison between what they told us in 2010 to 2011 survey. That was their report from fall 2010, what they expected over the next year, and then the right-hand bar is what they told us in fall 2011 about their expectations for the next year. You can see the vast majority of hospitals indicated that they expected no change in their hiring over the next year, but about 31% in 2011 said they expected to hire more in the following year than in the previous year. And a small share, about 9%, said they expected to hire fewer than last year. So again, these data are consistent with the sense that there may be more vacancies and more hiring right now. Hospitals were also asked about their planned employment growth for 2012 and 2013 as compared to fall 2011. And you can see that there's expected growth across all the nursing labor groups that we asked about. That growth rate looks like it'll be slightly higher for staff registered nurses, but it's increasing across all of the nursing groups. So to understand what these data mean for recently graduated nurses, I'm going to let Dolores talk about the survey work that she has done with the California Institute on Nursing and Healthcare.
Thank you, Joanne. And I would also like to say that Judy Berg just walked in the room, and as she begins her first day as the new Executive Director of the California Institute for Nursing and Healthcare. So I wanted to take now a few minutes to go over our new graduate hiring survey. We've been very concerned about new grads and the hiring dilemma that they have been facing after we've spent so much effort in the state of California to build educational capacity and to build our workforce. We conducted a statewide survey of the new grads in fall of 2011 that I'm going to report on now. And it was actually a repeat of a survey that we had conducted in fall of 2010. And we are planning to repeat the survey again this fall, so we'll have 3 years of data to kind of get a sense as to what's happening with the hiring experiences of new grads. This survey is is a collaboration between the Institute, UCLA School of Nursing, our California State Board of Registered Nursing, and the Association of California Nurse Leaders. In the fall of 2011, we did a random selection of all nurses that were newly licensed in California between April 2010 and August of 2011. And in that 18-month period, there were over 15,000 nurses that were newly licensed in the state of California. The newly licensed nurses were invited to participate on a web-based survey through a letter that was mailed to them by the Board of Registered Nursing. Findings from this survey indicated that as of, this is again fall of 2011, 43% of them were not yet hired as a registered nurse. That is consistent with the survey results we found in 2010, and it is also consistent with the survey that came from the National Student Nurses Association in September of 2011, in which they found 45% of new grads in California were unemployed. We asked our new grads what reasons that they were given for not being able to secure positions. And what were reported were 92% reported that they did not have experience as reasons that they could not find a job. 54% reported that there were no positions available, and 42% indicated that employers wanted nurses with a baccalaureate degree. We were also interested in what these new grads were doing in the meantime, and we found that they were working in non-RN health-related positions, that is, basically unlicensed positions, or they were, a lot of them were also volunteering in health-related fields. From this survey, we were also interested if education made a difference in terms of their ability to obtain a position as a registered nurse. And we found that across the board, regardless of where they received their pre-licensure training, they were all having a tough time. Our associate degree grads were having a little rougher time. At only 54% of them were reporting at that time having found a position. 62% of baccalaureate-prepared nurses and 60% of the entry-level masters had found positions. We also were interested, of course, where new grads were being employed. And understandingly, 62% were employed in hospitals, the largest employer of our nursing workforce. But about 13% were finding jobs in long-term care or post-acute care. Another 10% in a variety of community-based facilities, clinics, home health agencies, etc. And another 15% were in a variety of other positions. Among those that were able to find a job, we wanted to know about their experience. And we found that more than 30% of them, it took them more than 6 months to actually find a job. Now, these are the ones of the 43, so that's 67% that were actually working. The good news is that about 2/3 of them were reporting working in a job of choice, and 77% of them were working full-time. So that's kind of my update on the survey that we conducted in 2011 that we are now getting ready to repeat so that we have a better sense as to what's happening this year, the third time for the survey. Joanne?
Thank you, Dolores. Now, these data are consistent with other data that we have about employer and nurse perceptions. You can see a lot of alignment between employers reporting about their lack of hiring new graduates and their relative sense that there may be a surplus for staff nurses, but then their need to hire more nurses with experience. Other data sources are consistent with these findings. First, the 2010 survey of registered nurses conducted by the California Board of Registered Nursing indicates that there was a drop in the share of nurses under the age of 40 who were employed in nursing positions. Typically, those positions are, those younger nurses are nearly 100% employed in nursing positions, but between 2008 and 2010, it dropped down to close to 90% for nurses under the age of 30 and stayed below 95% across all nurses under the age of 40, which is still a high employment rate, but it's quite a notable drop over a short period of time. At the same time, there was an increase in the share of nurses over the age of 50 who are employed in nursing, as you can see in those right bars, particularly in nurses who are age 60 to 64. What these data suggest is that nurses who are nearing retirement or in a later stage of their careers were choosing to stay in the labor market and continue their employment rather than possibly retiring as they might have been planning. We also suspect that many of these older nurses also increased their hours of work because of the increased likelihood of their spouses being unemployed due to the recession. When nurses were asked their reasons for not working in nursing in the fall of 2010, you can see that there was a big increase between 2008 and 2010 in the share that said it was difficult to find a nursing position, and 15.7% in 2010 indicated that they had been laid off, which was not a response that we ever really saw before in the previous Board of Registered Nursing surveys. The share that had reported that they were not working because they were retired increased only slightly, and there was actually a decline in the share of nurses who said they were not working due to child care responsibilities or other family responsibilities. Whenever there is a shortage of nurses, you tend to see rapid increases in wages because employers are competing against each other to hire nurses, and one of the most effective ways to do that is to increase the salaries that you offer. When the labor market is more balanced, you tend to see nurse earnings stabilize or even decline relative to inflation. The 2008 to 2010 change in nurse earnings, which was virtually no change, is consistent with what we're observing. That through 2008 there was a shortage of nurses accompanied by rapid wage growth, but between 2008 and 2010 the labor market stabilized or even moved into a slight surplus. Nurses were asked about their future plans in the 2010 survey of RNs, and you can see that there was a decrease in the share of older nurses who said they planned to retire within the next 3 years. There was also an increase in the share who said they planned to continue working about as much as they were at the time they answered the survey. Among younger nurses under the age of 35, you can see that a large share indicated that they want to increase their hours of nursing work. It was an increase in the share that wanted to have more nursing hours as compared to the 2008 survey. Asked what they think is happening in the labor market. Specifically, they're asked to estimate the percentage of their graduates from the previous academic year who are employed in nursing in California and who might be unemployed. You can see that the deans and directors estimated in the fall 2010 survey that about 25% of the associate degree graduates were estimated to be out of work, about 20% of baccalaureate, and only about 6% of nurses with entry-level masters. So deans and directors were estimating that over the course of all their graduates over the previous year, a little over 21% did not have nursing work in California at the time they completed their annual school survey. Now, one of the approaches to deal with the slack labor market for new graduates is to establish transition to practice programs, and SYNC has been a leader in this work. Dolores?
Thank you, Joanne. Well, as we were concerned about new grads and the tough time they were having finding jobs, we explored a way in which we could help keep them engaged in the workforce and to increase the employability. What we learned after having focus groups around the state and having open forums was that there was an opportunity to develop a new type of transition to practice program for new grads. And as we've been developing these programs, they're kind of becoming known as school-based post-licensure internships. Now that's different than a hospital-based residency or a hospital-based, employer-based new graduate training program. And as Joanne had indicated earlier, that about 60% of the hospitals have continued, are reporting having new graduate training programs. But these transition to practice programs that the Institute initiated and began developing were in fact developed in partnership and collaboration with schools of nursing and employers. The programs were under the auspices of the Institute, and as I had indicated earlier, were actually in response to the new grad not finding jobs. Our goals of the program were to increase employability by increasing their skills and competencies and confidence, and to bridge the gap between academia and service. Next slide. Thank you. The Institute was fortunate to be able to receive grant funding from the Gordon and Betty Moore Foundation to launch 4 demonstration projects for these transition to practice programs in 2010 through 2011. Through 4 of the programs that were school-based, we enrolled around 350 new grads. The schools that were participating in this demonstration endeavor partnered with either one as a kind of a school and an employer, or with several healthcare facilities as more of a collaboration within the region. The service partners that participated in this transition to practice program were not required to hire the new grads that they were putting through this transition to practice program or helping us with, but we definitely found that it was important to identify practice partners who preferred to hire new grads once positions became open. As I indicated, we, for this demonstration project, received funding from Gordon and Betty Moore Foundation. We also received funding from Kaiser Permanente through their Health Education Education Fund, also through workforce investment boards, and of course, much in the way of in-kind contributions from not only the clinical but also the school partners. We also had some of the programs in which student registration fees were paid. Next slide, please. The curriculum of the transition to practice programs were designed in such a way that they did not repeat academic learning from what they had just received in nursing school, but in fact academic learning that helped bridge that gap between academia and professional practice. We incorporated the cues and competencies in the curriculum all the way along. We had didactic classroom classes. We had mini simulations, different kinds of simulations in the sim labs, and of course then our intensive clinical precepting experience. The preceptors also did ongoing assessment of critical thinking and competency skills of the new grads. Because the clinical preceptors were such an important part of our partnerships, we also provided preceptor training for our skilled nurses that were, and our experienced nurses that were helping us in this endeavor. Some of the characteristics of these transition programs included the fact that all enrollees were post-licensure and have passed the NCLEX test. Therefore, they were all new grads that were licensed as registered nurses. These were basically unpaid internships for which they received academic credit, and they ranged between 12 and 18 weeks in length, depending upon the particular focus of the program. All participants received an industry-recognized certificate of completion from the Institute and the participating college. And the important thing of that certificate of completion is that it is starting to set a standard that all of the programs, falling within this modality, they're meeting particular standards, so there's a degree of consistency. And certainly the programs are designed in such a way that does meet local needs. In evaluating the transition to practice programs, we found that they have made quite a difference in the confidence and the competencies of new grads as they transition from academia into professional practice. We also found that when we completed the evaluation of the initial programs, that nearly all new grads that had completed these programs were in fact employed as RNs. Evaluation of the impact of these programs is continuing, and the importance of this evaluation is that we are continuing to build the evidence that transition to practice programs are an important part of our nursing education. I just want to kind of close on the current status of our transition to practice programs. Following the 4 demonstration programs in the San Francisco Bay Area, 26 programs have now been organized or are planned to be given across the state. Over 900 new grads have now participated in these programs since 2010. We have also expanded with initial success, I'm pleased to say, into non-traditional settings. And when I say non-traditional for employment, first employment for a new grad. That has included primary care clinics, school nursing, home health and hospice. And regarding the home health program, we're really quite pleased that we, in partnering with the Department of Health Services, have worked out a process by which home health agencies that hire a new grad that has gone through one of our transition to practice programs may seek the waiver for the 1-year experience requirement for nurses being hired into a home health agency. So I think being able to demonstrate the value of these transition to practice programs and in the area of home health has been a particular important step that has been taken. We are in the process right now also of developing a curriculum for long-term care and post-acute care. For more information about the transition practice program, on this slide is the Institute website. Please do access the information there, as well as getting in touch with Nikki West, the Institute's program director for the transition to practice program. Joanne?
Great. Thank you, Dolores. These programs are very interesting and have been advocated by a number of people. It's nice to see them being implemented effectively and providing opportunities for new graduates to gain skills if they want to enter other settings than a hospital. Now, the current labor market situation plays into the forecasts that are conducted for the Board of Registered Nursing every 2 years. These forecasts have been updated slightly, and I'll present them to you today. The basic forecast of supply approach is what is commonly called a stock and flow model. And what that means is that the blue circle there is the stock of nurses who have active licenses living in California who could potentially be working. So that is our overall labor force. Now that labor force changes size with an inflow of nurses who are going to be new graduates and people coming from other states or other countries, and then an outflow of nurses who are typically retirements or people who are moving to other states or other countries. Of that stock of nurses, that stock makes decisions about how much they will work and whether they will work, and that gives us our full-time equivalent supply of registered nurses. Those decisions about employment are typically based on earnings, work environment, and family circumstances. Now, over the 2012-2013 period, the expectations of the deans and directors of nursing schools is that there would be a drop in RN graduations. So in the annual school report, deans and directors are asked what their new enrollment was in the previous academic year and then what they project their enrollment to be in the next 1 and 2 years. The bold numbers are the responses from the deans and directors to the survey in the first 3 columns. And then the rightmost column is the number of graduations, with the first 3 rows being the actual number of graduations reported by deans and directors, and then the last 4 rows with the asterisks being projections based on the enrollment from 2 years prior. You can see that there was a drop in graduations between the 2009 and 2010 and the 2010-2011 academic years. Based on the enrollments from a couple years ago, we do expect graduations to be somewhat higher in the current academic year, and we will know for sure when we get the annual school surveys back this fall. And then there's expected to be a bit of a drop in graduations again by the 2012-2013 academic year. Now, if we take these data and put them into the supply forecasting model, you can see that we have a range of estimates about what supply might be. The dark line is what I consider the best supply forecast, which is based on the parameters in the model that seem most plausible. That low supply forecast is the number of nurses that California will have if we have relatively few nurses move to California from other states and relatively high numbers of California nurses moving outside of the state. The high supply forecast is the converse. If we have very few of our nurses move to another state and we have relatively high numbers of nurses from other states coming here. Given that California has not been a net importer of nurses for over a decade now, I don't expect that that high supply forecast is likely to come true. But if California's labor market overall improves more rapidly than in other states, we may have many nurses moving here along with their spouses or partners because their spouses and partners might be more able to get work in California than in other states. Our unemployment rate, however, has been higher than the national average, so that doesn't seem very likely right now. Variations in employment patterns also can affect what the resulting full-time equivalent employment is. So the best supply forecast numbers here are then attached to estimates of what the employment rates for nurses will be in California. The best supply forecast is making the assumption that essentially the labor market and the employment patterns of RNs will return in the next few years to roughly what they were in around 2006 to 2008, with the vast majority of younger nurses working and slightly lower rates of employment among older nurses than we had in 2010. The high employment rate forecast assumes that we continue to have high employment rates of older nurses and that younger nurses also return to higher employment rates. And the low forecast is the converse, assuming that younger nurses continue to find it difficult to get jobs, but at the same time that older nurses begin to leave their jobs and retire at the rate that they were doing so in 2008. There's not a lot of variation that comes from these employment rate changes, and that's largely because the vast majority of nurses under the age of 50 are employed in nursing. Nursing employment rates are remarkable. It would be very hard to find any other profession where over 90% of the people trained and licensed in that profession are working in the field under the age of 50. If we take these full-time equivalent RN estimates and compare them to our population, you can see that California is expected to have continued growth in the number of full-time equivalent RNs per 100,000 population into the future. The lower horizontal dashed line is the U.S. 25th percentile, which would be the rate at which California would finally be above number 37 in this country. Right now we're at about number 47 in the country in the RN per 100,000 population ratio. The higher dashed line is the national average. And if we continue graduations and migration patterns at the rate that I expect, then by the early 2020 decade, we will be reaching the national average. Now, of course, this is assuming that the national average does not also increase or change over this time period. Comparing these supply numbers to demand is tricky because it is really not entirely clear what the appropriate measure of demand is. We often like to compare these numbers to national benchmarks, as I just did, employed nurses per 100,000. And making the assumption that we need to retain the same number of employed nurses per 100,000 enables us to project what future RN demand would be based on maintaining a constant ratio. The Employment Development Department also produces a forecast of what the demand will be 10 years into the future. The most recent forecast then was published based on 2010 data, and they made a forecast for what demand would be in 2020. We've also created estimates of future demand based on current hospital employment and assuming that patient days will grow at an increasing rate as the population ages. And finally, we reviewed the literature on what the potential impact of the Affordable Care Act implementation might be. I'll address this last item right now. The best estimates of the impact of the Affordable Care Act on the registered nurse labor market is that it's likely to be neutral on overall RN employment, but it may result in changes in the work settings in which RNs continue to be employed. The movement towards accountable care organizations and improved transitions of care may reduce the employment opportunities in hospitals, but increase them in transitional care and home health types of environments. The reduction in expected emergency department use when people can get better access to primary care may reduce emergency department positions but increase RN positions in primary care. So in the net, there's no reason to believe that the Affordable Care Act is going to have a particular impact on the registered nurse numbers that we need. So you can see the various estimates of the forecasts of nursing demand here. The orange lines are all different full-time equivalent RN to population ratios. The top line would assume that our goal would be to reach the national average of full-time equivalent RNs per 100,000. The solid line below that would be the national 25th percentile, which would put us at ranking number 37 in the country. And the bottom line would be to maintain the current full-time equivalent RNs per population, which keeps us at about number 47 or 48 in the United States. The bluish line that is sloped more steeply is based on estimating that the demand for inpatient care and likely outpatient care as well will increase with the aging of our population. So that line increases more steeply than the straight population numbers because it's accounting for population aging. And that line produces a demand estimate that's very close to what the Employment Development Department forecasts for 2020. If we put it all together, we can lay the supply forecasts on top of the demand forecasts. The two red lines are two of the supply forecasts. The darker one is what I call the best supply forecast, and the lower one is the low supply forecast. If we had relatively low numbers of nurses migrating to California, and we also have relatively low employment rates. The light blue line is based on estimates of aging population and growth in hospital patient days as well as outpatient demand. And then the dashed line is the national 25th percentile. You can see, depending on what assumptions you make about graduations, migration from other states, and our need for nurses, that you get different estimates of whether we are going to be moving into another shortage. What I take away from this chart is that if we are able to maintain the number of graduations that we have had over the past several years, our labor market should remain fairly balanced. But if we have decreases in the number of graduations or significant movements of nurses to other states, such as if they cannot find a job in California so they choose to move to Texas and don't come back, then we could very easily find ourselves in a shortage situation again. So let's talk about what the implications of all of this are for ensuring an adequate nurse supply for California into the future. Well, the first question, of course, is do we have a shortage now, or will we in the future? And whether we have a shortage now gets into questions of whether current employment levels are adequate, or whether hospitals and other employment settings should be using nurses more aggressively in order to meet patient care needs or improve quality of care. It's difficult to compare California to other states in terms of the RN per 100,000 ratio, because we don't really know if California should be at the national average or at the 25th percentile or some other level. California's population is relatively younger and healthier than in many other states, so the national average might be more nurses than we need, but somehow being at the bottom of the list is probably not where we should be either. Finally, there's the question of what our population needs are and what we can afford. Economic demand is based on how much money is available in the healthcare system to employ the different kinds of people that deliver healthcare services. And that amount of money in the system may not align with what we think our population needs are. So will a shortage emerge or worsen? Well, we know in the short term that demand dropped with the recession, and we expect that as the economy continues to improve, the demand will probably continue to increase. The Affordable Care Act implementation overall will probably increase demand to some extent, but perhaps not so much for registered nurses as for advanced practice nurses, such as nurse practitioners. And we know that right now supply is relatively high due to the economic recession, because many nurses appear to have increased their hours of work in order to make up for losses of income from spouses who are unemployed. Finally, as the economy recovers, we do expect to have greater retirements and reduced hours of work. So the concerns for workforce policy are fairly straightforward. First, we did have a drop in the number of graduations over the past academic year, and if RN education contracts, our supply is very likely to fall short of demand. We need to be graduating about 11,000 nurses a year in order to meet projected demand. Now, if recent graduates who can't find work leave California permanently, that also is going to cause a problem with our nursing supply. So we need to think about fostering opportunities for those graduates to gain on-the-job skills and also to pursue additional education in a more affordable fashion so that they stay in California, retain their skills, and are able to find jobs as the labor market improves for them. There are a few places and ways that we are tracking data to enable real-time and ongoing assessment of what's happening. First, you can go to the Nursing Demand and Supply Dashboard website to see the results of the employer surveys and other surveys that are conducted as they become available. The link for this site is at the top of this page. You also can go to the Board of Registered Nursing website, and I'm going to point out a little nuance to that website. There is not a top-level tab for publications. To get to the publications, you have to click on the Forms tab, and then a gray box will appear below, and you can see there that Publications then becomes an option. So if you've had trouble finding these survey reports on their website, this is the reason why. The standardized format for the Department of Consumer Affairs makes it a little tricky to find the Publications link. Within that Publications link, though, you will find the Annual Schools Report, which includes a public use Excel workbook that summarizes data by region and by type of program. It's a very easy interface for you to work with if you want data. You can also find the reports for registered nurse surveys that are published every 2 years. The 2012 survey is currently in data analysis and should be posted in early 2013. And then a few months after the RN survey reports are published, full reports updating RN forecasts are provided, and we're working on regional forecasts, which we have not updated for a few years. You can also find various other studies on the BRN website, which range from studies of the endorsement of nurses from other states to research on the diversity of California's nursing workforce. So what is happening next? Well, we're very excited because we're collaborating with the Hospital Association of Southern California to do a joint vacancy turnover and hiring survey. For the past 2 years, with the support of the Moore Foundation, the UCSF survey has been sent to chief nursing officers and has requested a fairly large amount of information that we know you've had to ask your human resources liaisons to provide for you. At the same time, HASC has been doing a quarterly HR director survey about not just RN employment, but employment for a whole variety of health professions. We've worked together carefully to align these two survey approaches to create a single survey instrument that your human resources directors can complete to provide the vacancy, turnover, and hiring data that will enable us richer analysis of the nursing labor market as well as continued analysis of all the other health professions that HASC has traditionally surveyed about. That first joint survey will be sent October 1st, and we do hope that you encourage all of your human resources directors to complete this survey. Fortunately, they've been very good about responding to the HASC survey in the past, and this joint effort is going to result in new products that are going to enrich your ability to estimate what your future needs are and what the labor market will look like for you. Also on October 1st, UCSF is going to send a separate survey for chief nursing officers that is going to be much shorter and easier than in the past 2 years, so we hope that you're able to take a few minutes to complete this for us because it will have questions that are specifically for chief nursing officers that are separate from what your human resources directors might know. The 2012 Board of Registered Nursing Survey of RNs, as I told you, is in analysis now, and the forecast will come out shortly after that report is published. And then in October, the 2011-2012 BRN Annual School Survey is going to go into the field, and the report for that will be published in early 2013. So at this time, we're happy to entertain your questions. We can take, all of the panelists are able to take questions at this time. Let's see, so we have questions that are being typed in onto the website. The first question is, do we have breakdowns by specialty or unit needs for the larger hospitals in California? We did not ask hospitals to provide us detailed unit-level survey data, and we have not attempted to do that kind of analysis formally. So unfortunately, we do not have that information at this time. The second question is from a recent graduate who is concerned about being timed out of new graduate programs because this graduate has been had graduated a year ago and has been continuing to look for positions and has been volunteering, but now officially no longer counts as a new graduate in many of these programs. Dolores and Terry, do you have any perspectives on strategies or ways to approach this kind of a problem?
Well, this is Dolores, and I think this is something that we're concerned about. As we are preparing for an exodus of our retiring nurses as the economy improves and our nurses who have hung on to their jobs longer than perhaps they had originally planned are going to be exiting, and I think we are needing to prepare for a nursing shortage facing California relatively in the near future. And yet we have these nurses, such as the new grad who's not been able to find a job. This is why we've really been promoting these transition to practice programs, so that we are helping to bridge them from their learning, their academia to their professional practice. And what is encouraging is the number of new programs, the interest in the programs that are growing around the state. But we're going to have to look very soon at these new grads who've been out for a longer period of time, and actually needing to almost look upon them as needing refresher programs. It's a dilemma we're going to have to address.
Right. I think, Dolores, this is Terry. Dolores represents my thoughts as well. I think it's something that we'll definitely have to look into, and we understand the challenges that many of the new grads are having with finding employment in our member hospitals. And yeah, it sounds as if this has been an ongoing challenge for some of the new grads out there, and you know, what can we do to address that problem? So I would agree with Dolores and her comments that we need to discuss this and look into it further.
Great. So we have another related question that I think Dolores will be great to answer. Somebody asked whether preceptors for these new graduate programs are competing with the need for preceptors for student nurses. So in other words, I think, are the preceptors of these new graduate transition programs the same people who would be precepting nurses who are going through their student rotations?
You know, that's a very good question, Joanne, and I think folks have been concerned about that. And I think when they've had the precepting in the hospitals, there has been every effort to either have the new grad transition to practice program either in the summertime when, you know, they're not competing with the schools, or ensuring that the intensive clinical is off shifts, you know, evenings, nights, so that you know, the experienced nurses are available to work with the nurses in the transition and not needing to you know, compete with the clinical experiences from our schools of nursing. But I think that's also why we really have been promoting the transition to practice programs outside of the acute care setting, where, you know, we don't generally have that kind of conflict.
Great. Now, somebody asked if we have data about regional variation in the BSN preferred or required criteria. And we have not analyzed that specifically, so I'm going to make a note to take a look at that. And I think when we produce the report for the next Chief Nursing Officer survey, we'll make sure that we take a look at those data across regions and see if there's any variation.
Joanne, I would like to say that as we do the new grad hiring survey for this fall, you know, we are able to look at regionally whether it's, you know, what the new grads are reporting.
Right.
So we'll be able to have that data as well, which is another, you know, variation on it.
Yes, we can put those two data sources together, which I think will be useful. Now, Dolores, a question for you was asked whether you were able to look at your new graduate hiring survey data by the month of graduation. In other words, were those who graduated in, say, August 2011 more likely to have jobs or to have found jobs more quickly than those who had graduated in April 2010?
We looked at, we do know when they graduated and how long they've been looking for a job. It does go back to, you know, the first question that we had about being timed out. You know, they're concerned about being timed out. And I think as we put together our survey for this fall, we'll be sure that we do it in such a way that that analysis would be easily accomplished.
Great. Now, there are two questions here that I think really are addressing similar issues. One asks, what efforts are underway to prepare nurses for new roles anticipated by the Affordable Care Act? And the other asks us for our thoughts about how to deal with growth and demand for long-term care and home health, given that the traditional focus on RN entry-level education is in the acute care area. I know that a number of nursing schools are looking at their curricula carefully to identify how they can better integrate community health, long-term care, and non-acute settings into their curriculum. And of course, some of what is in their curriculum is dictated by what is on the NCLEX examinations. And I know that the people at NCLEX are constantly having discussions and thinking carefully about what needs to be in that examination in order to reflect healthcare needs. Dolores, do you have further thoughts on this?
Well, I think one of the most important things that we need to work with our educators as we move forward is ensuring that our student nurses do not look upon employment in the hospital as the expectation. Healthcare is shifting. The employment growth for new grads is going to be in out-of-hospital settings, and we need to work with our students, with our faculties, and our healthcare providers to really open up the practice settings outside of the acute care hospital and start to change that mindset that has evolved over the last few decades, that hospital nursing is where it's all at.
Yeah, I think I agree with that. Now let's see, a question was asked about how the transition to practice programs that SYNC has developed align with the new hire programs, and whether the curricula of the SYNC program is informing new graduate transition or new graduate orientation programs that hospitals are using.
Well,
I explained that question well. Okay.
I think I have it here. I think our transition to practice programs, the way I look at them, are school-based, community-based, unpaid internships that are different from the employer new hire or and residency training programs. But what I think these transition to practice programs have done, and our evaluation has certainly indicated that, is that it allows an employer to bring on a new grad at a higher level in which they don't need to go in and work with them to really kind of integrate academic learning to, with practice. They're coming in at a higher skill level and a higher degree of competencies, so they're able to then move into their the employer-based new grad training program and residency at a faster level and be incorporated into staffing at a faster level. It does not take place of the employer's commitment though for residencies, as those are longer-term programs which lend themselves to ensuring decreased turnover. I hope that kind of answered that question.
Great. And another question for you, Dolores. We're going to keep you talking. Let's see. One person noted that they have seen some advertisements from hospitals regarding residency programs, but in looking at the program, this person found that they don't allow the RN new graduate to perform nursing functions in the residency program. And she is asking then what is the point and value of the program if they're not performing nursing functions during the program?
Since I'm not familiar with what the particular programs that she or he may be addressing, I'm not sure that I can really answer that.
Yeah, my only speculation would be that there may be concerns about, especially for an unpaid internship or residency, essentially having a person perform licensed nursing work without pay, which can be essentially a problem for the paid RNs or potentially paid RNs. There may be internal rules that the hospital is trying to follow, or agreements with their labor partners, or also just general national labor laws regarding unpaid work.
Well, and
my guess is that area.
Yes, and I think our programs that have been housed in a school of nursing are housed for a couple of reasons. First of all, it takes care of the insurance, the liability, et cetera, because once again, these new grads are actually students. And so it takes it out of some of those potential employment conflicts, but because they're RNs, they can now fully function as a registered nurse at their clinical precepted site in ways that they were not able to as a student. But that is a concern relative to an employer-based program.
So there is another question about how the expected shortage and faculty retirements are going to affect the ability to continue to provide large numbers of nursing graduates, and what are we expecting about future faculty retirements. The data that I have looked at suggests that for most hospitals, the challenge with expanding or maintaining the size of their programs is not necessarily that they cannot find enough faculty, it's that they don't have enough money to hire faculty.
Right.
So I have yet to meet a dean or director in the state of California whose college president or a grant funder said, I will give you money to hire 2 more faculty and expand your program, and they've had to give the money back because they couldn't find anybody. What I hear much more often is that they couldn't hire because their college president didn't give them money, or because they just didn't have the funds to maintain the positions. Now that said, in many cases, nursing faculty salaries are substantially lower than what a similarly educated nurse could make in a practice setting. So there is a continuing need to take a look at what nursing faculty salaries are relative to the rest of the labor market for nurses, so that they don't fall behind and therefore draw nurses with graduate education, master's and doctoral degrees into other clinical fields. We have had a big push towards increasing the number of nurses with doctorates, which includes the Doctorate of Nursing Practice, and those new nurses with doctorates are qualified to serve as faculty across the state. Nationally, we're seeing tremendous growth in the number of doctorally prepared nurses, which does bode well for the future of nursing supply, but we'll have to see if the salaries within nursing schools can keep pace. Now, are there any differences in the hiring of a baccalaureate versus a master's degree applicant? The data that we showed from nursing deans and directors indicated that their estimates are that about 94% of master's educated nurses are employed in California, and a significantly lower share of baccalaureate educated nurses are employed in California, which would suggest that the master's degree applicants are either more competitive or they happen to be in markets that have more jobs available. There's a question about the move towards hiring baccalaureate nurses only, and will there still leave a role for associate degree programs? And certainly during this recession and period where there has been somewhat less demand for nurses, employers are being pickier and favoring baccalaureate educated nurses. But there has been a lot of consensus among both many employers as well as what we've seen from the Campaign for Action for the Future of Nursing that associate degree programs play a very important role in providing entry-level preparation for registered nurses. And the National Association of Community Colleges and other education organizations are focusing more on the need to continue lifelong learning regardless of what program you graduate from initially, so that the opportunities are available for associate degree graduates to continue their education, and that is also should be true for baccalaureate graduates and all graduates.
And Joanne, I would just like to put in a plug right now for the California Collaborative Model of Nursing Education, which is a model providing for seamless progression from the associate degree program into the baccalaureate, in such a way that the new grad would be able to complete the baccalaureate in 1 more year of full-time study. 70% of the community colleges in the state of California have signed on or interested in that model of nursing education, and all of the CSU campuses are stepping up to that. The California Action Coalition and the Institute just received a grant from the Robert Wood Johnson Foundation to launch this collaborative model in the Los Angeles region, with a partnership between Cal State LA and began 7. We're up to 9 community colleges now in that region. And this is a very, very important means by which California is going to be able to increase the number of baccalaureate-prepared nurses that we need in the state, but built upon the foundation that the community colleges are offering. And that's a very important consideration as we move forward.
Great. Now another question for you, Dolores. Are nursing schools experiencing any financial support or incentives to develop transition to practice programs, or are they doing this largely out of, how are they doing this financially?
Well, the transition to practice programs that we've been involved in have largely been grant funded up to this point. And a good portion of that funding actually goes to the school to pay for the cost of faculty involved in the transition to practice program. Mary O'Connor in Southern California with the Health Workforce Initiative out of Orange County and the Inland Empire has been working with community colleges down there, in which I think there's been a little bit more of an in-kind contribution through the community colleges and their work-study program down there. So it has varied in terms of how the schools have, been participating. There's even a couple of schools in which the new grad is paying to participate in the program, and generally that funding goes to the school.
Let's see. We have an observation that the push towards increasing baccalaureate, graduate, or RN to BSN educational opportunities, as well as the sense that we're going to have increasing demand for nurses in California and across the country, is likely to put a significant increase on the demand for nursing education capacity. And I do agree with that observation. There also is another observation that the impact of the potential impact to the associate degree curriculum on a moving focus outside of acute care is also a factor that is likely to lead to all kinds of educational changes in nursing education, both in California and across the country. Now, a question was asked that I think it's a great thing to point out, that the question is, how does the 43% rate of not yet employed new RN graduates from the SINC survey comparing to the rate of not yet employed graduates in other fields? And I have seen reports that up to 50% of college graduates in general are unemployed right now. So it may very well be that the current difficulty of nurses in finding work after graduating from their programs is not any worse, in fact might even be better than some other fields. I think many engineers are able to find work right now, depending on their field of engineering. Bioengineering is not so good for a bachelor's degree, but for a graduate degree it's pretty good. Mechanical and electrical and software all have good labor markets for engineering. But for people graduating from teaching schools with English degrees, journalism, many other majors are finding it much more difficult to get work now overall. And so the nursing experience is not necessarily unique in the current economy. Let's see, there's another question about the demand for nurses to migrate to other states for employment and whether that may increase or decrease. And I think that's an excellent question. It's hard to guess, because if the economy is recovering more rapidly in other states and there are more jobs in general in those other states, it will be easier for two-career couples to relocate out of California than to stay in California. Many nurses, of course, are single and are making decisions about where they want to live and work independently, but many are also married or partnered and need to make joint career decisions. So the overall employment opportunities for both nurses and non-nurses are going to be important across states. California may have an improving nurse labor market slowly, but outside of engineering in the Silicon Valley area, our unemployment rate is higher than the rest of the country. And so, so I would say there's kind of a mixed sense. Now, the last questions that we had is about the archiving of this webinar. This webinar has been recorded. We're going to merge together the question and answers from today's session as well as last Friday's session and create a single webinar link that will be available on the web. It'll be available on the website that I put on the screen. Somebody asked me to bring back this Center for the Health Professions link. And so we'll have it there. We will email it to everybody who was invited to this webinar as well as everybody who registered for the webinar to make sure that you all get it. And then we will make sure that we are sending out any other information. Somebody asked if they can get a copy of the shortened CNO survey that we're going to be launching in a few days. And I ask that you email me directly, and I will send that to you. But of course, if you're a chief nursing officer, you're going to get it on October 1st, whether or not you ask for it. And we do hope that you will complete these surveys so that we can continue to provide you up-to-date information about what's happening in the workforce. Thank you very much for your attending this webinar. And thank you, Dolores and Terry, for being my partners in this work. It's been a pleasure to work with you. And Dolores, I know that even though there is a new executive director at SYNC, I know I'm going to still be able to continue to work with you in the future, which I'm very glad about.
Great. Thank you.
Thank you, everybody.